Bismillah ar-Rahman ar-Rahim, my dear students. This is our lecture for today. This is the malabsorption syndrome. This is the first part of the lecture. Malabsorption syndrome, as you know, are conditions rather than diagnosis. When we say the condition, which means that it's just like the cough, pain, or any other thing that has a causes rather than it is give a diagnosis. So it is a clinical condition rather than diagnosis. Clinical condition means caused by many diagnoses. So by definition, these are insufficient condition that caused by insufficient assimilation of ingested nutrient caused by maldigestion or of malabsorption. Maldigestion means defect of the digestions in the intestinal lumen, while the malabsorption means defect in the intestinal mucosal absorption. It has something in common with the clinical features. When we see it, we can diagnose malabsorption syndrome. These are the abdominal tension, steatorrhea, muscle wasting, poor weight gain, and weight loss growth retardation. The absence of the diarrhea, or even the presence of the normal stool, or even the constipation, as in cases of the celiac disease, not ruled out the diagnosis of the etiology. It could be caused by the intestinal causes, or exocrine pancreatic causes, or liver and biliary or specific defects. Intestinal could be caused by the anatomical defect, for example, resection of large length of the bowel, or a chronic infection, for example, giardiasis, or mucosal lesion, for example, celiac disease, exocrine pancreatic dysfunction or abnormality, for example, cystic fibrosis, chronic protein caloric malnutrition, Schwachman-Diamond syndrome, which is also, in addition to the exocrine abnormality, also have a skeletal problem, and the chronic pancreatitis for any reason, for example, stones or chronic infection. Liver and biliary tree, for example, biliary atresia and other cholestatic defects. Specific defects, for example, beta lipoproteinemia for the fat malabsorption for the protein enterokinase, example, enterokinase deficiency and disaccharidase deficiency for the carbohydrate, which could be either congenital or acquired. Also, vitamins and the trace element, for example, pernicious anemia for B12 and zinc deficiency as in case of the acrodermatitis enterobody. This is just the overview of the causes of the malabsorption, and you can see this is a need to be child to be evaluated. Always we started with the clinical manifestation. The family history is important to take because some cases of the malabsorptions, familial, for example, cases of the galactosemia or congenital chloride diarrhea, and some cases multifactorial, for example, in cases of the celiac disease. All of these family history play a role. أيضا history of the onset is also important. In some cases might start at birth, for example, galactosemia if the child take the lactose formula or breast milk, and the congenital chloride diarrhea also in cases of the celiac disease, usually the onset at the end of the first year, the second half of the first year. The symptoms occurrence with the introduction and reintroduction of the offending agent. The stool characteristic of the steatorrhea. Steatorrhea is most of the time it is caused by the fat malabsorption. This is what give the pale, greasy, foul smell, floating characteristic of the stool. Failure to thrive is very important, but keeping in mind failure to thrive can be caused by many other causes, for example, systemic and even psychosocial disorder. The growth pattern. The growth will be affected by the malabsorption syndrome. The first thing to be affected is the weight. The second is the length. The chronic malabsorption, even the OFC will be affected. Signs of the malnutrition بصورة عامة: lethargy, decreased subcutaneous tissue, muscle wasting, edema, clubbing, depigmentation of the skin and hair. Also might have cheilosis, stomatitis, glossitis, and diffuse abdominal pain. Here are some pictures for the malabsorption. You can see the abdominal tension. We can see the muscle wasting and the best seen in the gluteal region and the upper thighs. Skin changes and the edema. This is caused by the hypoproteinemia. This is actually this case of the kwashiorkor. This is the muscle wasting is very clear. You can see the wrinkling of the skin and loss of the subcutaneous tissue and loss of the bulk of the muscle. This is the vitamin A deficiency, xerosis, and the pitote spot. This is the pitote spot. This is very characteristic for the vitamin A deficiency. Now we come for the laboratory test. Laboratory test, the most important screening test for the malabsorption is the examination of stool for the fat. This can be done by the general stool examination, looking for the fat droplet. Any fat droplet more than 6 to 8 droplet by low power field is abnormal. This is طبعا نسوي احنا بالسودان 3 stain. Also any result abnormal result in the general stool, I mean any reading more than 6 to 8 droplet should have 72 hours quantitative fecal test. We give the patient a load of the fat and see how much it is excreted in the stool. Normally less than 7% is excreted. Any excretion more than 7% of the total intake is abnormal and suggest malabsorption. Keeping in mind this might have a false positive in cases of the premature baby and full term, because premature baby can absorb only 65 to 75%. So 35 to 25 normally is secreted, which is higher than the 7%. Full term, only 90% of the ingested fat is absorbed, so 10% will be secreted. Also, it is higher than the 7%. So this should be explained carefully in the premature and full term baby. Serum carotene level, this is a precursor for the vitamin A. Sweat chloride test for this cystic fibrosis. Exocrine pancreatic test can be tested by the direct test, assay of secretin and cholecystokinin, or indirect by the ELISA test to assess the elastase one in the stool. And the most important screening test for the pancreatic dysfunction is the serum level of the trypsinogen. Measurement of the serum trypsinogen has proven to be a good screening test for pancreatic insufficiency, in that it is reflected residual excrete pancreatic dysfunction. لذلك احنا نقول انه the most important screening test for the pancreatic function is trypsinogen. Complete blood picture, serum albumin, serum immunoglobulin level is also, for example, complete blood picture might show the megaloblastic anemia or iron deficiency anemia for the B12 folate deficiency or iron deficiency. Measurement of the carbohydrate in the stool. Measurement of the carbohydrate in the stool. Malabsorption of the carbohydrate will lead to the presence of the carbohydrate in the stool, and we can test it by the clinic test our clinic test tablet. This is by adding 10 drops of water to 5 drops of the stool, and there is a sheet, and we can compare the color to the sheet, or color of the stool to the sheet, and it is the range from the trace to +4. Any reading or any color changes more than 2 plus means that there is a possibility of the sugar malabsorption. Malabsorption of the sugar lead to the accumulation of this sugar, especially lactose, in the large bowel and acted on by the microorganism there, lead to the liberation of the acid and gases. The acid is the Lactic acid, example, lactic acid, short chain fatty acid, for example, butyrate, acetate, and propionate, while the gases were methane with CO2 and hydrogen gas. So the presence of these gases, acid, lactic acid, and short chain fatty acid will lead to the acidic stool. Any reading of the pH stool less than 5.6, this is indicative of the acidic stool, which is indicate the carbohydrate malabsorption. Calculation of the osmotic gap. This is by the equation. Here the equation, and any reading of the stool sodium less than 70 and osmotic gap more than 100. This is indicate carbohydrate malabsorption. breath hydrogen test. يمكن احنا حكينا على اللاكتوز malabsorption or sugar malabsorption بصورة عامة. When it is reached the large bowel, it will be acted on by the microorganism lead to the liberation of the acid and gas. الأسيد حكينا عليه على cleanliness test for the acidic stool. الهيدروجين أو الغاز بصورة عامة have an increase in the large bowel lead to the absorption in the small and large bowel الحقيقة lead to the absorption through the portal circulation, and when it is reached the lung it will be exhaled in the breath in the expiration. So if we have a test to measure, to give the patient loading of the sugar, loading sugar, and measure how much hydrogen is increased in the breath, this will be useful for the diagnosis of the high carbohydrate malabsorption. This is called breath hydrogen test, and this is the method. Just by giving the patient about 1 to 2 gram per kg, maximum 50 gram, and then breath is collected in sealed plastic container at time interval up to 2 hours after the injection. Raise in the hydrogen more than 20 parts per million. This is associated with carbohydrate malabsorption. Serum albumin. This is indicate the malabsorption of the protein, which could be either by the poor intake بصورة عامة, poor intake, or malabsorption of the protein, or protein losing enteropathy, or liver disease, or loss through the kidneys or bear, etc. Kidney مثلا classical example هو nephrotic syndrome. Measurement of the stool alpha-1 antitrypsin deficiency. This is indicative for the indicative for the protein losing enteropathy. Some nutrient might be measured directly in the stool, for example, in the blood. Sorry, some nutrient might be measured directly in the blood. Serum level of the iron, folic acid, calcium, zinc, magnesium, vitamin D, and its metabolite, vitamin A and B12. These might have, it is a part of the general spectrum of the malabsorption. For example, in celiac disease or cystic fibrosis or giardiasis might have malabsorption of any of these, or sometimes the malabsorption for the specific element. For example, just an example where I give you zinc, for example. Zinc malabsorption, this is in acrodermatitis enteropathica, for example, B12 in pernicious anemia, etc. Partial thromboplastin time and prothrombin time. This is why indicate vitamin K dependent clotting factor deficiency, which indirectly indicate that there is a deficiency of the vitamin K, which might indicate malabsorption of vitamin K. So in the we will start with the microbiological. The only common infection that cause malabsorption actually is Giardia. Giardia can be identified in the stool sample by the direct examination, microscopic examination of the stool, and see the cyst and trophozoid. Could be also by the duodenal aspiration for the trophozoid, or even in the duodenal mucosa. So by sometimes we need to take a fluid from the duodenal and also biopsy to identify the Giardia. Immunoassay, this is by the stool for the antigen and the blood for the antibody. The other thing is the bacteria culture. For example, in cases of the stasis or blind loop syndrome, or sometimes there is impaired immune function, we might have bacterial overgrowth. HIV clear. Sometimes HIV also causes malabsorption. Small biopsy. We take the small biopsy for the identification of the bowel mucosa. This is can diagnose celiac disease by the villus and total and partial villus atrophy, beta lipoproteinemia, lymphangiectasia, congenital microvillus, inclusion disease, and many other conditions. بالحقيقة احنا السمول بول بايبسي مو بس ندزها للباثولوجي لكن ايضا ندزها للبكتيريولوجي فور ذا جارديا. حكينا على جارديا وقلنا ممكن diagnose by the duodenal biopsy or aspiration of the duodenal fluid for the identification of the trophozoid. فأيضا ندز سامبل إلى البكتيريولوجي وسامبل آخر إلى الكيمستري by the assay the disaccharidase activity. We can diagnose أيضا galactosemia. Okay. Hematological hypochromic clear hypochromic macrocysts indicate iron deficiency anemia. Macrocysts indicate folic acid or B12, acanthocyte, beta lipoproteinemia, and any defect in the lymphocyte or lymphocyte defect or neutropenia might indicate Shachman diamond syndrome اللي حكينا عليها. قلنا انه ممكن انه it is usually associated with pancreatic exocrine insufficiency and skeletal changes. The imaging procedure is of limited value in malabsorption disorder. A plain abdomen and barium contrast study might suggest the cause and the site for the intestinal stasis. For example, in barium, in case of malabsorption, have flocculation of the bowel, have loss of the normal continuity of the bowel, loss of the normal hastration, and sometimes even widening of the proximal small bowel. These are the radiological findings of the malabsorption. Ultrasound, pancreatic lesion, biliary tree abnormalities, and the stone might be shown by the ultrasound. Now we will start with the specific disease that causes malabsorption. We start with the giardiasis. Giardiasis is a very common problem. It is caused by the Giardia lamblia, which is a flagellated protozoan. The normal inhabitant of the flagella is the duodenum and the small intestine. It is endemic all over the world, and it is transmitted by the fecal-oral route through the drinking water. Fecal-oral route will facilitate the person-to-person transmission. About a quarter of those patients with Giardia will have the no symptom. They are asymptomatic, and those are very dangerous because they separate the infection to the adults in the household, in the school, in the daycare center, without diagnosis, without being suffering from any problem. So they are the facilitate the separate to household contacts. Giardia can occur at any age, but is rare in neonate, and it is more prevalent in children than adults. Giardia infection could be followed by the asymptomatic cyst passage اللي قلنا عليه 25%. أو acute self-limiting diarrhea, the patient present with severe diarrhea, with severe abdominal pain, with vomiting, with fever, or the third presentation اللي يهمنا موضوع malabsorption هو the chronic syndrome of the diarrhea malabsorption or weight loss. Patients who develop chronic diarrhea usually complain of profound malaise, lassitude, headache, and diffuse abdominal pain in association with bouts of the diarrhea. In most of the cases, the diarrhea is steatorrhea, and sometimes it is alternate with the period of the constipation or normal bowel habit. This syndrome of the giardiasis might presence احنا سميناها syndrome لأنه there is multiple presentation. There are many modes of presentation. That is why we call this syndrome. This syndrome can be present for many months until specific therapy is given, or it might subside spontaneously. So without treatment, it can persist for several months, and the patient every now and then present with diarrhea, with abdominal pain, with headache, with fever, with lassitude. In addition to the weight loss in children, weight loss is very important, etc. Chronic diarrhea frequently lead to the malabsorption. And the malabsorption of different items of the fatty steatorrhea, vitamin A, B12, and iodine carbohydrate malabsorption. About 20 to 40% of the patients with giardiasis will develop lactose intolerance, which can persist for a week after treatment and need to be differentiated from relapsing giardiasis or reinfection, which means that the patient with the giardiasis, there will be damaging to the intestinal mucosa because of the chronic infection with giardia lead to the deficiency of the lactase enzyme. This will lead to the lactose intolerance. So if we treat the giardiasis, giardiasis will be eradicated from the intestine, but the patient still have diarrhea because of the lactose intolerance. That is why we have to give the lactose. In the diagnosis, we start with the stool or duodenal aspirate for detection of the cyst or thrombozoid or antigen. General stool بالحقيقة it needs 3 successive days negative stool in order to declare that the patient is negative for giardiasis. Because if we take the only one stool, general stool, the yield rate will be 70%. If it's 2, the 85, and the third sample it raises to the 90%. That is why when we do general stool for the giardiasis is negative, we should not say that this is negative for giardia. We should wait for the further 2 stool samples. In order to increase the yield rate for the detection, so I can in the duodenal aspirate or in the general stool, patient should not take the antibiotic, anti-diarrheal drug, antiacid, enema, and laxative preparation for 48 to 72 hours before the stool collection for identification of the giardia, because it can be interfere with the identification of the organism by altering their morphological characteristic or by causing a temporary disappearance of the parasite from the stool. So any patient sent for the general stool or duodenal aspirate should not take these items because it will interfere with the detection of the. So other laboratory finding is by the our laboratory tool is aspiration or biopsy of the duodenum or the upper jejunum. This is for the detection of the parasite and also seeing the histological changes in the intestinal mucosa. Immunological by the enzyme immune assay or immunofluorescence assay. This is by detection of the antigen in the stool or antibody in the serum, and also PCR and genome based detection system specific for giardia have been used in environmental monitoring. So these are the methods for the how to diagnose the giardia in the treatment. The drug of the choice بالحقيقة هو metronidazole 15 mg per kg per day in 3 divided doses for 5 days, or tinidazole 50 mg per kg single dose. These 2 drugs can be used for the treatment of the giardias. Now we come. This slide shows the life cycle of the giardia. Giardia, the infective stage is the cyst. The cyst is the diagnostic stage بالحقيقة هو trophozoite and cyst. The cyst is ingested by the person and it will be in the small intestine, especially the jejunum. It will liberate the trophozoite, which causes the symptom, and the trophozoite and the cyst is the diagnostic stage. The cyst will contaminate the food, so it is foodborne by fecal-oral route, and these are the pictures of the cyst and the trophozoite. This is the trophozoite. Okay. In the radiology, in this part, we see the normal barium follow-through. Barium follow-through, you can see the normal hastration, you can see the normal filtry appearance, and there is continuity of the bowel. While in the malabsorption syndrome, by the way, this is not specific for the giardia. Any malabsorption can lead to this picture. There is loss of the hastration. تشوفوا هنا اكو hastration هنا ماكو hastration. هنا اكو filtry appearance هنا ماكو filtry appearance. هنا اكو continuity هنا ماكو continuity. شوف هنا قطعة وهنا قطعة، وين الكونتينيوتي؟ وين اكو continuity؟ and there is a flocculation of the bowel. Flocculation means ملطخة، هنا لطخة هنا لطخة هنا لطخة. So these are the signs of the malabsorption in barium follow through. راح أعيدها. أول شيء هو flocculation of the bowel, loss of the continuity, loss of the normal filtry appearance, loss of the hastration. Now we come for the other problems, the lactose intolerance. Lactose intolerance is due to the deficiency of the lactase enzyme, which is a disaccharidase enzyme. The lactase الحقيقة act on the lactose to convert it to the galactose and the glucose. Both of these are monosaccharide and will be absorbed in the intestine. While the disaccharide is not absorbed directly from the intestine, it needs disaccharidase enzyme, which is the lactase. So if there is deficiency of the lactase enzyme, this will lead to the lactose intolerance. Causes of the lactose intolerance could be congenital. Congenital, this is rare, lifelong, probably autosomal recessive, but some cases the lactose tolerance is increased with the age. The other thing is the developmental. Developmental means the level of the lactase enzyme change with the life, and it is the highest level of the lactose delivery at the last week of the pregnancy and during the first 3 years of the life. So any child, any infant, any neonate, any child during the first 3 years of their life, since birth, the first 3 years, probably will not have any manifestation of the lactase deficiency. But if the patient delivered and prematurely before the last weeks of the pregnancy, where the level of the lactase is high, and in those children after the age of 3 years, sometimes there is lactase deficiency. Lactase deficiency, the incidence of the development of lactase deficiency is more common in black. It is occurring about 85%, while the Asian is 40 and white is only 15%. These figures is from the USA. This is also known as the adult onset hypolactasia, and it is autosomal recessive. Secondary, the third type is the secondary. Secondary, the level of the lactase بالحقيقة الإنسان because is marginal. So any injury to the intestinal mucosa lead to the deficiency of the lactase enzyme. This injury is of different because the most common was gastroenteritis, especially the chronic gastroenteritis caused by the viral infection, is the damage of the intestinal mucosa and damage the cell that produce the lactase enzyme, lead to the deficiency of the lactase enzyme, leading to the lactose intolerance. Also, it could be caused by the other problem, for example, celiac disease, giardia, malnutrition, etc. Chemotherapy, radiotherapy أيضا might lead to the damage to the intestine mucosa to the secondary lactase deficiency. Clinically, the patient present with the symptom of the malabsorption after the ingestion of the milk lead to the explosive watery diarrhea associated with abdominal stention, borborygmy, flatulence, and excoriated diarrhea. There is a syndrome of recurrent vague crampy abdominal pain has been attributed to the lactose intolerance. حكينا عليه يمكن بالسكول age children هواية يجون قسم من الأطفال عندهم abdominal pain recurrent, especially on the ingestion of the milk. This is actually of the developmental investigation. يمكن هذه general stool for the pH and reducing substance, mucosal biopsy for the activity of the disaccharide enzyme, and the blood glucose level failed to raise more than 10 milligram after 10 milligram per deciliter after ingestion of 1 gram per kg lactose and breath hydrogen excretion. يمكن كل ذني عبرنا عليهم بالمحاضرة. Treatment: remove of the milk from the diet. إذن the patient عنده lactose intolerance, lactase deficiency, lactose intolerance, we can remove the milk from the diet and there will no problem. بالحقيقة مو بس الملك, anything that is يدخل بتكوين الملك, which means that the removal should be total. لكن قسم من الأطفال during the first 2 years شو نسوي لهم ذولا إذا هم dependent on the milk? At that time we have to use the lactose-free formula. This is one of the indications for the lactose-free formula. أيضا أكو lactase preparation is available in the market, and a tablet with lactase activity can also be ingested with meal, and change the milk to the live culture yogurt contain bacteria that produce lactase enzyme and thus frequently tolerated by lactase deficient enzyme. These are the 4 things should be kept in mind when treating a patient with lactose intolerance.